As a 17-year-old, I am aware I am naive about a lot of things. There are many things that I am yet to learn, and there are many things I am unaware of. One thing that has become extremely apparent to me, however, is that we have really perfected the art of getting sick. In the past century alone, there have been close to 20 major epidemics. Most of these have been fairly serious illnesses, and yet have also been a catalyst for major medical advancements. With the typhoid outbreak of 1906, we had a vaccine by 1911. With diphtheria in 1921, there was a vaccine by 1926. And with the H1N1 epidemic, there was a vaccine available by December of the same year. And of course, COVID-19 had major attempts and efforts to curb its effects. Keep bouncing back. Medical knowledge has grown exponentially in the past century, yet there is still an epidemic facing 19.7 million Americans that has been going around for decades on end with little to no medical help. Addiction. Growing up, it was a hot thing to avoid. Any mention of drugs, tobacco, alcohol was eradicated from sight unless it was to tell us youth to stay away. It was hard for me to understand how anyone could stray to drugs despite knowing its effects, despite knowing that there would be consequences. The way I viewed people with addiction was wrong. I viewed them as the bad people, the people who didn't listen to rules, who made bad choices every time there was a choice. Growing up, I was comfortable with these assumptions because they kept me out of the equation. It was a simple plan to follow. If you filled your mind and your brain with good things, things that made you feel whole, things that were good, you would never become one of those people. As I began to analyze my life, of course, I realized I could not have been more wrong. I began to notice and think about how many people in my own life, how many people I looked up to that struggled with these things. Amy Winehouse, Carrie Fisher, Robin Williams, just to name a few. I quickly became fascinated with the war on drugs, learning about its history, the science behind it, and how it affected the American life. Most importantly, I learned that this was a very widespread issue that was ingrained into our society and that I wanted to do something about it. The ACLU predicts that 1 in 8 American people will struggle with addiction in their lifetime. That means there are people outside in the audience with you who will struggle with addiction. Could be any one of us, and it could be me. The way we can overcome these obstacles and help each other grow is by reaching out to those in our communities and helping to break those stigmas. In the early 1970s, the US, after realizing it had a growing problem on its hands, started the war on drugs. The campaign focused on eradicating the illegal drug trade by focusing on the heavy criminalization of drugs, zero-tolerance policies, and mass incarceration. Notice I didn't say anything about health-based aid. Mandatory minimums, which are standards set in place to ensure predefined prison sentences despite special circumstances, were even set in the 80s, showing that the US health system so far has focused more on punishment than recovery. And as a result, the US now has the largest prison population in the world. Now you might be thinking, what's the big deal? Well, aside from largely disrupting communities, it has shown to have adverse effects on its goal. A Washington study from 2017 showed that overdose rates skyrocketed 129% following individuals' release from prison. The drug market has gotten more efficient ways to deal drugs, while the number of people addicted to drugs has seen no significant improvement all this time. That's because no matter how hard the law enforcement system might try to make sure that people who are dealing and using drugs are kept behind bars, there have been minimal efforts in the US to treat addiction as a health problem. Aside from physical reactions, degenerative effects, and cancer-causing elements of drugs, there are also chronic mental health effects to be aware of, such as depression, aggression, and paranoia. Luckily, there have been countless examples of positive change from countries around the world. Switzerland, for example, has opened many safe-use heroin clinics where people can safely use heroin, have access to clean needles, and most importantly, of course, rehabilitation programs. Portugal, too, has become the first country in the world to decriminalize all drugs. The result? A plummet in their drug-related death rates, the lowest in the European Union and 50 times lower than that of the US. They are an astonishing success story because above all, they value health and they value empathy. By giving them syringe kits, some people think that we are enabling them, helping them get their fix. But we do not advocate consumption. We try to talk to them, help them improve their lives. However, if they do not want to stop using, it is better if they do so safely, says Americo Nave, a psychologist and president of the outreach organization Kresker. The simple truth is that no matter how hard we try, when people feel threatened, when they feel judged, they are less likely to reach out to help. And shame helps no one on the path to recovery. I know the US is capable of changing history. The solution to the war on drugs might not seem intelligent to the naked eye. How can we win a war by letting the enemy go? But just like the answer to countless of diseases before was to treat people with empathy and medical care and protect ourselves and others, we need to reach out to those in our communities. We need to find empathy. I may be naive about a lot of things, but I do believe in the power of empathy. Thank you.